Hey everybody, welcome to video 67. This is going to be the final lecture for our male reproductive system. In this video, we're going to take a look at the external genitalia as well as common disorders of the male reproductive system. So there are two parts to the male external genitalia. They are the penis and the scrotum. We've already previously mentioned the scrotum. The penis is going to have 3 columns of erectile tissue. If you're following along and you're coloring the packets, you may have saw these, but the filling of blood during arousal is what's going to cause the penis to become stiff during arousal. And without them, the penis would be unable to do its job. Remember, part 2 of the function of the reproductive system is to permit fertilization. And so without these 3 columns of erectile tissue, it would be unable to do so. Also associated with the penis is the foreskin. It's a double-folded casing. It's retractable. And it's going to be found over top of the glans, which is the enlarged shaft of the penis. So those 3 spongy tissue, you have 2 very large superolateral chambers that are both known as the corpus cavernosa, and then you have a smaller inferior chamber known as the corpus spongiosa. The urethra is going to sit within the corpus spongiosa. Remember, you have the urethra going through the penis here. And so during arousal, nitric oxide is going to be released from different nerve endings located within the penis. There's lots and lots of nerve endings located here, but that nitric oxide is going to result in the relaxation of the blood vessels located within, which is going to cause a lot more dilation, a lot more blood flow flowing into the penis, and very little is going to be flowing out.
Mr. Bob Carlson, contact the office.
So you have these penile arteries that are dilating. You're getting a lot of blood flow into these spongy tissues, but the venules are being compressed, and so you have much less blood leaving, and so you have excess blood being basically stored or moved into the penis, and that is what is going to allow for an erection. One thing here associated is a vasectomy. It's a form of male birth control that is basically a surgical procedure where the vas deferens is going to be severed and sealed. And so remember, the vas deferens is one of those ducts that's going to be coming from the epididymis, and it's very easily accessible through the scrotum, and so you're just going to cut that tube and seal it off, and so sperm are unable to pass through. You get from the vas deferens, they're unable to get to the ejaculatory duct or the urethra, and as a result, they basically are not ejaculated. It is possible to reverse a vasectomy, though typically surgeons will consider it a fairly permanent form of sterilization. They do not suggest getting one reversed. Also mentioning the foreskin. The foreskin is commonly removed during circumcision, but we're seeing that actually less and less. It used to be a very common practice, not only because of religious reasons, but it was also thought that the removal of the foreskin would lower your risk of cancer and urinary tract infections. But current research shows that you pretty much have the same risk either way, men. And so really circumcisions are only going to be performed when asked based on religious or cultural reasons, but about 1/6 of the world population is circumcised. So some disorders associated with the male reproductive system, many of them are going to lead to either infertility or sterility. There is a difference between the two. Infertility is going to be a significantly reduced ability, while sterility is a complete inability. And so it all depends on whether you still have a chance or you have no chance of being able to reproduce. Infertility, you still have a very small chance, though it is significantly reduced. Sterility is complete inability. And so different short or long-term diseases can cause oligospermia, which is what we call a low sperm count. I will say on oligospermia, that is still infertility because you still have some sperm, so it is still possible to reproduce, but it is not sterility because you still have that chance. Another disorder, cryptorchidism, is when the testes, which typically are near the kidneys until about month 7, fail to descend into the scrotum. So this is while the baby is in utero, while the male is in utero. During the 7th month, those testes are supposed to descend, puncture through that abdominal wall, and find themselves in the scrotum. If that doesn't happen, it is called cryptorchidism, although it's fairly easy to treat with an injection of testosterone. Others, testicular tumors, typically will arise out of the seminiferous tubules, which can lead to a mass on that particular testis that houses those seminiferous tubules. Another one, prostate cancers. These are very important to detect early because it's very easy for them to spread just based on the prostate tissue. And any sort of growth or spreading of a prostate cancer can squeeze or close off the urethra, making it very difficult for urination. Prostate cancers are also actually the leading cause of non-skin cancers in men. Others, urinary tract infections are of the urinary system for men, or for men and women. You also run the risk of STDs of the same tissue. Lots and lots of STDs. We won't focus on any one particularly here, but I will say in men, STDs are of lower likelihood to be fatal or to be very difficult to treat because of the longer urethra. It's easier for a disease to be detected before it reaches the bladder or anything else like that. Another disorder, the inguinal hernia, is going to be caused by a swelling of the scrotum, and you get the swelling because the abdominal wall, which is already very, very weak, is going to get punctured through by digestive organs, usually the small intestine. So what you end up with is a part of your small intestine that is punctured through the abdominal wall, separating the scrotum from the torso, and now part of your small intestines are now being housed in the scrotum right next to the testes and everything like that, and it can be very, very painful. Okay, so those are some of the common disorders associated with the male reproductive system, as well as talking about male external genitalia. As always, if you have questions, let me know.